Alright, hello, my name is Ryan Shawnoff. I'm going to be going over a brief look into what a kyphoplasty is and what procedure or why you would have that procedure done, and basically how your activities of daily life can be affected by the compression fractures that lead into a kyphoplasty. So here's my audience, and some with the camera obviously. So I will begin my presentation on what a kyphoplasty is. So to put it simply, a kyphoplasty is a procedure that is done to correct compression fractures of the spinal column. Now, of course, compression fractures can take place anywhere in the body, but realistic as of right now, we're talking about in the spinal column. During a compression or a kyphoplasty, a doctor will use a sharp pen-like tool to create. They'll have an incision in the spine. They'll go through and they'll put the sharp end of the tool into the spine, into the vertebrae affected, and they will inject a cement into the affected spinal column or spinal vertebrae to fill in the compression fractures. The image that I have right here is what is a lateral and posterior view of what a healthy spine would look like. And I actually have a model right here of a healthy spinal column despite a compression fracture right here. And moving on to the next slide, we will discuss what a compression fracture is and what it looks like. So, a compression fracture occurs when any sort of force, blood force or traumatic force, is placed on the spinal column, anywhere that could be causing a fracture. As you can see right here on the presentation or the PowerPoint, there is a image of a X-ray image of what it looks like, I hope.
Yes.
Okay, so as you can see in this image right here, you'll see what a compression fracture looks like on the vertebrae. In the MRI imaging, you'll see that this compression fracture is on T12. However, in my model over here, I have it on T10 to show that it can also affect the ribs, and going forward with that, I'll explain that in further detail. But compression fracture, as I said, it does occur from blood force trauma, and it can be very painful and impede anyone's ability to perform certain tasks. Prior to kyphoplasty, it can take up to about 8 to 10 weeks to completely heal from the incident. However, everyone's different, and there are certain things to take into consideration when talking about recovery time. One thing that will be used before the procedure and after is, of course, different drugs, pain medications, muscle relaxants, and anti-inflammatory agents to obviously help alleviate the symptoms and speed up recovery time. There may also be some bracing that can be used to help with stability. This particular brace I will see going into the following slide. We're just going to be talking about certain things, activities that will be affected because of the compression fracture, which I'll get back to the bracing in a little bit. But obviously you can see that mobility can be affected, just trying to move around, simply anything that could put any sort of vibrations on the spine will of course lead to more pain. Your breathing could be affected. This is where I was going into the T10 vertebrae, since it is attached to the lower ribs. Every time you inhale or exhale, you are expanding your chest, which of course, when the ribs are going out with it, you're going to be having pain in the ribs as well as in the back. Sitting and standing and walking are obviously going to be something that's affected, going with mobility. Sitting is actually something you would think would help, but it might actually be worse for some people with back pain. Of course, then posture could be affected, gait, trunk range of motion, and anything as far as reaching up in high shelves or just out in general. Moving on, we move into the physical therapy and other sort of treatment options that we have for following a kyphoplasty and compression fractures. Of course, we have moist heat, which we have an image here of what moist heat is, just to kind of help relax the muscles in the area. We have a unit that is called a Hyvamat, which is an electromagnetic current massage. You can follow that up with MFR, and I believe you could actually do both of these at the same time to just kind of get two things out of the way as well. You can also see you can do gentle exercise. Obviously, you don't want to do anything that could cause any further damage, because then that kind of just defeats the whole purpose. You can progress exercise, but again, it's completely up to the individual, whether or not they can tolerate it and how well their, I guess, potential rehab is going. You'll have full body isometrics that can be done. I'll be showing examples of these treatment options here in a little bit. You have isotonic treatment options as well. Then of course, as I just mentioned, you have the TLSO brace, which is a thoracic lumbar sacral orthesis brace, and it may be used to aid in stability. It might also be used to decrease the movement, so you're not running the risk of further damaging the affected vertebrae. So to go over one of the treatment options, where you have symmetrical rolling, which can be used to relieve stress on the back. And I have two lovely volunteers. They have a PTA, Alicia, and our PTA tech, Sarah. So she is going to go ahead and just demonstrate how symmetrical rolling would be done.
Okay, so you're going to lay down. Okay, and you're going to cross over your right foot over your left. Bring your arms kind of like this. Okay, and kind of clap your fingers if that's easier. Okay, and we're going to rock back and forth to use some momentum. So start to your right and then to your left. We're going to do it 3 times, and then you're going to roll onto your side. Okay? Ready? 1, 2, 3. There you go. And then you can push yourself up from the side. So come over to the side. Okay, and you relax your arms. Use this arm to push up like this, and use this elbow to help push yourself up. Onto your side.
Okay.
Okay, there you go. And you can bring your feet to the side here. And that's it.
All right, there we go. So obviously I would like to sit there and ask, how's your pain? But since you obviously don't have a compression fracture that I know of, you can see that in the instance that there would be that, people will find that with this they could start having their mobility back and start being able to return to their daily activities without any without further impairment or any other damaging or pain. Moving on, I have, following that, just my references slide on where I got a lot of this information. Of course, I'm actually speaking from experience as well, as I had this procedure done a few years ago. So I can personally say that it is very painful and can be quite debilitating. And through physical therapy, as a matter of fact, I was able to regain range of motion. I was able to start participating in my normal activities again with little pain, and then of course getting back to a normal state. So I believe that concludes my presentation on a kyphoplasty, and that's that.